This Docs on Call is brought to you by Excellus, Blue Cross Blue Shield, and UHS. I'm here with Dr. Michael Lissy with UHS Orthopedics in Binghamton, and we're going to talk about meniscal tear repair. What is meniscal tear?
So a meniscal tear is one of the most common reasons anybody comes to see an orthopedic surgeon. The meniscus, if you'll recall, is a spongy sort of material in between the top bone and the bottom bone in your knee, and it helps dissipate some of the force of impact. And sometimes when you have a large force or a twisting force or you do something funny, you tweak your knee, you can tear that meniscus. And that tear can either be just from a huge amount of force or from a meniscus that's maybe getting a little bit older.
What are signs or symptoms of a tear?
So a bad tear will limit your ability to move your knee. It might feel like it's catching or clicking or locking inside your knee, and that's the actual meniscus mechanically blocking you from being able to move your knee. If you don't have a mechanical block, you might just feel some pain or inflammation, swelling inside your knee.
And treatment options that are available?
So whenever possible, particularly in a younger athletic population, we try and conserve the meniscus. We try and keep what you have there because we know the more meniscus you have, the less arthritis you're going to have down the road. So whenever possible, we try and fix the two pieces of the meniscus back to each other. Sometimes the tear is so big or it's so bad or it's in a part of the meniscus that doesn't get any blood supply. And if it doesn't get any blood supply, it's simply not going to heal no matter what we do to it. And if that's the case, then we end up just taking out a part of the meniscus and smoothing it off so that it doesn't cause any other damage to the cartilage inside your knee.
And the recovery from this?
So if we just smooth it off, you can walk out of the operating room and you'll be just fine. There isn't much recovery at all. It's just a local pain control for the surgery itself. But if we do a repair, it depends a little bit on the size of the repair. A larger repair will have a longer recovery where you'll be in a brace for a period of time. You might be non-weight bearing for a period of time, and certainly there'll be rehab involved where you go to a physical therapist to get stronger.
All right. Thank you, Dr. Michael Lissy with UHS. If you want more information, go to our website, WBNG.com. If you want to leave a comment or ask a question, call 584-7362, 584-7-DOC.